time to here, but I have a ton of moving boxes behind me, so I'm staying off of the camera, okay?
Sure. That's fine. Hi,
It's
Tiff.
gonna be truthful.
That's fair.
Hello.
Hi, Tiff. How are you doing?
I'm good. How are you?
Good, thank you. Oh, this is good. We've got quite a few people joining.
Hello.
Hi. Hi, Stephanie. Hello. Hi, we have our guest joining from MiracleFeet just now.
Hi, everyone. Hello.
Hello.
Hi. Hello. I'll just double check the guest list and make sure that everybody's here. Yeah. Now, I think we have almost everyone here. I'm just sending the link to some of our other colleagues. Hi, Terry. And Francie. Perfect. Hi, Francie. Hello. Hi.
Plants, Francie.
I think that we're pretty much full now, I think. So shall we kick off?
Sure. Yeah, that sounds great. Kira, do you want to share your screen with the PowerPoint?
Yes,
Okay.
let me see if I can get this to work.
So would you guys like to introduce yourselves as well? Just
Yes,
for everyone here?
absolutely. Yes. Great. Okay, well, thank you so much, everybody, for being here today and giving MiracleFeet this opportunity to share our work with you. We're really excited and honored to be here, and we're so grateful for WELLReceived recent gift to MiracleFeet. So I'm Dana Corbett. I'm the development officer on our fundraising team. I've been at MiracleFeet for about a year and a half now, and I'm based in Chapel Hill, North Carolina, where our headquarters are located. So. And then I'm joined by my colleague, Kira, who can introduce herself as well.
Yeah, my name is Kira Corcoran. I'm also in the Chapel Hill office with Dana on the fundraising team. I'm the donor engagement manager, and I've been with MiracleFeet about 2.5 years now.
Yeah, great. So we'll present some slides for about 15 minutes or so, and then we'll be available afterwards to answer any of your questions. So what we'll be talking about today is the issue of untreated clubfoot, and we're going to get into a lot of the details and the statistics about the global scale of the problem, but we first thought it would be important to give you a real visual of what the problem is and what it looks like before we get into those details. So I'm going to show you a quick video of a boy named Alan, and he was born in Brazil with bilateral clubfoot about 10 years ago. And that previous clip was what he looked like before treatment when he first came to the clinic, and then this was him a few years ago when he came back for a checkup. So that is what clubfoot looks like on both feet, and that is treated clubfoot. And Alan was one of MiracleFeet's first patients about 10 years ago. And we tell his story a lot because it really just shows how solvable this issue is and how transformative treatment can be for a child. And I don't think any of us would have to imagine too much to think about how different Alan's life would be if he hadn't been treated for clubfoot. And he's just one of the thousands of children who are born with clubfoot every year.
And that is kind of the whole purpose of MiracleFeet, is that we're tackling this problem of untreated clubfoot. This is an issue that we care deeply about because clubfoot is a different story for different kids depending on where they're born. And I know some of you may have a personal connection to clubfoot. Maybe your brother, sister, uncle, aunt, son, daughter was born with clubfoot. So it's kind of an issue that maybe not a lot of people know about. Just because some people have heard of it and it's treated so routinely in higher income countries like the United States or other countries in Europe. But it's a common birth defect and it's very often invisible, but it's actually the most common birth defect in the US. It affects 1 in 800 babies born nationwide. And because prevalence in each country can be different based on population and birth rates, 90% of all babies born with clubfoot are from low and middle income countries. And in these countries, access to treatment is very low. And even though there is a treatment for clubfoot, 4 out of 5 children who are born with clubfoot don't have access to it. And it's one of the single largest causes of physical disability in the world. And living with a disability anywhere can bring challenges, but it's especially devastating in low-income countries where there's so much stigma and shame attached to having a disability. Children living with disabilities in these countries are at much higher risk of neglect, malnutrition, physical and sexual abuse, being marginalized in their communities, excluded from school and other social activities. This little girl in this picture, her name is Ashika, and she grew up only 30 minutes from a clubfoot clinic in Nepal, but she was brought in at 9 years old for the first time to the clinic. And just seeing the look on her face and the condition of her feet, for me, is a really powerful example of why our work is so important. You can see her feet are slightly twisted, but this was taken after treatment had already begun. So this is just an in-progress picture of her. And thankfully, Ashika was able to get treated and she'll be able to go to school and join her peers and all the other activities kids her age can do. And MiracleFeet exists because clubfoot disability is completely treatable. It's just a matter of having access to care. All of these world-class athletes were born with clubfoot, but you never know it because you can see they use their feet really well. And it's because, like most kids born with clubfoot in wealthy countries, they were treated within weeks of being born, so it didn't become a lifelong disability for them.
So now I'll talk a little bit about what this magic treatment is, and it's called the Ponseti method. And so clubfoot used to be treated with a very complicated and invasive surgery that was largely inaccessible in low resource settings. And so that's one of the main reasons why children historically with clubfoot in these places haven't had many options for care. But in the past 15 years or so, there's been a significant shift in the medical community, and a non-surgical technique known as the Ponseti method has now replaced surgery as the gold standard for clubfoot treatment all over the world, including in high-income countries. And it seems slightly counterintuitive in terms of a medical breakthrough, but this low-cost solution has actually revolutionized clubfoot treatment, and it's why MiracleFeet was created just over 10 years ago. So after decades of being overlooked, underfunded, and neglected, this issue is finally solvable for all children, no matter where they're born. And so ideally, treatment should begin within the first 6 months after a baby is born, while their feet are still flexible and pliable. And there are 3 important steps in the treatment process. So first, the feet are gently manipulated and a series of casts are applied over a period of 2 to 3 months to gradually correct the position of the foot. And then there's a simple outpatient procedure to release the Achilles tendon. And after that, the child wears a brace at night while sleeping for about 4 to 5 years. And this just maintains the position, the corrected position of the foot, and is similar to wearing a retainer on your teeth after orthodontic treatment. And in addition to being appropriate for low resource settings, the other great thing about the Ponseti method is how effective it is. So when performed correctly, it restores the full functionality of the feet in 95% of cases.
And so how MiracleFeet does this work is really important to us. We're really trying to build a long-term and sustainable solution. So this involves building capacity within each country. So MiracleFeet doesn't have to stick around to get forever. We're essentially trying to work ourselves out of a job. So our philosophy is not to put doctors on airplanes and to send them to these countries. We're really trying to build local capacity and ownership within the existing healthcare infrastructure of each country. We just help lay the foundation for clinical training in the Ponseti method that Dana just talked about, building up skills for local providers to be able to deliver high quality treatment, and training local trainers to build a sustainable cycle of ensuring providers have the skills they need to treat clubfoot. From the very beginning of each program, we create and really focus on integrating and institutionalizing clubfoot treatment into existing public health infrastructure. So eventually the financial and administrative management can be handed over to these local healthcare systems. This is our picture of partners in Nicaragua, Rebecca on our left, our country coordinator for Nicaragua, and then 2 orthopedic surgeons, Dr. Baladares and Dr. Garcia, and also Scarlett, the parent educator for this clinic. And this is a really typical image of who you would see at most MiracleFeet supported clinics around the world. And as we've scaled our model, we create tools that help support our expansion while maintaining high treatment quality and keeping costs low. First, we developed the award-winning MiracleFeet brace, pictured here, and this was designed in partnership with Stanford School of Design. This brace can be produced for $20 compared to the cost of braces in the US that most cost $1,000 or more. It comes in 7 sizes and has all of the same easy-to-use features as all other expensive braces, but for a fraction of the cost. And this is the brace that the child would wear for 4 to 5 years while they're trying to retain the feet placement after they go through the casting phase. And on this slide, you can see a picture of our cutting edge monitoring and evaluation system we developed with funding from Google a couple years ago. It's a mobile phone based app that enables providers to collect patient information at each clinic visit. And because cell phones are easy to use and 3G mobile service is readily available, the system really works even in remote areas. Innovation has been in MiracleFeet's DNA since the beginning, and we're leading the nonprofit space in the way we collect and use this data, which is critical to how we measure our impact. And just to touch on COVID briefly, although everything has been disrupted globally and we've been living through a year now of devastation and upheaval, MiracleFeet has been able to track patients in real time thanks to this app. And it's enabled us to be really closely involved in the quality of our programs, even when we couldn't do a lot of travel to the programs that we normally would. And so it's tools like this that can really help us maintain the quality of our programs. But you don't have to take just our word for it. To get a better sense of the real life impact on quality of life for kids, we've retained an external impact evaluation firm, 60 Decibels, to assess the quality of our programs. For us, they surveyed over 1,500 families in 7 countries over the past 3 years. And they speak to these families over the phone in their local language, focusing on how well their children are doing after treatment. And the results were astounding even to us. 92% of families report that their child can walk every day. 97% report an increase in quality of life. And these numbers look the same essentially in every country they studied. And 60 Decibels tells us that these results are really rare and places in the top 5% of their portfolio, which is great. And according to 60 Decibels, who've done over 450 kinds of these studies, the results are incredibly rare. So the CEO of the company actually said, MiracleFeet is in the top 5%, if not the top, in terms of quality of life improvement and consistency across different geographies. Their interpretation, which I agree with, is this treatment really works when done correctly. Parents value the service we provide, and recognizing that it is life transforming, and MiracleFeet is implementing extremely well.
So with our local partners, we've reached nearly 60,000 children since we started work about 10 years ago. And today we work in 327 clinics across 29 countries around the world with a network of over 600 orthopedic surgeons and physical therapists, many of whom were trained in the Ponseti method by MiracleFeet. And we've also successfully raised over $30 million in funding, and we're really proud of the movement of supporters like WELLReceived that we've been able to bring into our mission to end this problem for good. So our long-term goal is to reach at least 70% of all children who are born with clubfoot in every country and ensure that they're getting the highest quality of treatment so that they can live active and healthy lives. In some countries like Liberia, Sri Lanka, and Paraguay, where we have programs, we have already reached this goal and proven that it's possible. And so for us, success can look like a lot of different things. So maybe the most obvious is the kids you see on this slide who are running, playing, going to school, and just living their lives like we would want any normal kid to. But it goes deeper than this as well. And success also looks like the systemic change that we are making possible. So through our partners, we raise awareness of Clubfoot through community outreach, and we make sure that families and community members know that Clubfoot is treatable and where treatment is available. And we take pride in training local providers and trainers in the Ponseti method to build local training and treatment capacity. And then for long-term success, we actively engage with government officials to raise Clubfoot as a priority at the national level. And we advocate for Clubfoot care to be institutionalized and mainstreamed into existing health systems. So all of these things, from the smiling faces to the systemic transformation, are what we set out to achieve. So we just want to close by saying thank you again so much for your time today and for your interest in MiracleFeet's work. We really appreciate the opportunity to share our story with you, and we're happy to take any of your questions.
Perfect. Thank you so much for taking the time to come on and to chat with us. Giving back is a really important thing for WellReceived. It's one of our core values. So we were really happy to partner with MiracleFeet to be our August giving back partner, because we want to give to charities that are making a difference. To the lives of children, or to underserved populations, to give them access to medical care. So we're really happy to partner with MiracleFeet.
Great. Yeah, I think there's a lot of synergies between our missions, so it's great that we found this partnership together. Thanks.
But yeah, would anyone like to go with the first question?
Yeah, I've got a question. I'm wondering what the biggest myth that you generally encounter about Clubfoot.
Yeah, Kira, you may get more. So Kira, as our donor engagement manager, gets a lot of questions through like Instagram and emails and stuff like that. Do you have one that you think comes up a lot?
I think the biggest myth is that people assume the treatment is surgical and that it's going to be incredibly expensive. And because it is non-surgical, the cost to treat a child is actually pretty low. It's $481 is the total treatment cost for a child. So it doesn't cost thousands of dollars to provide treatment. It's just a low cost of $481 because it is non-surgical.
And that I'll just add is, obviously it's an average across our programs, but the treatment is provided to kids and their families for free through MiracleFeet, and then we incur that cost, so it's delivered to families for free. But yeah.
Thank you.
Yeah.
Would anybody else like to go?
I'd like to say something. First off, I really love the innovativeness of you guys creating your own brace. I found that to be really interesting. And did I see that? Do you guys partner with Clark's? Was that a tag for Clark's? Oh, that's really cool.
Mm-hmm.
Yeah, that's really neat. That's a really good brand too overall for like Posturepedic and things like that. So I really appreciate that you guys have found an alternative for, because like you said, braces here are expensive. So that's really awesome. And by the way, go Tar Heels, because I'm in North Carolina too. So
oh, nice.
I love Chapel Hill. It's one of my favorite places to get.
Awesome.
I'll have to visit you guys sometime.
Yes, absolutely. Always welcome. Yeah, we're like right in the triangle. There's like a lot of 3 main universities, so you never know like which way people are gonna lean around here. But
right now I'm wearing Duke blue though, so shame on me.
Great. Yeah. But Clark's has been one of our partners, I want to say since 2014. And they were really instrumental in helping design the shoe for the brace. So the brace itself was designed through the Stanford D School, like Kira mentioned. And then the shoe like clips into the bar so that children can get different size shoes as they grow and their feet get bigger. And so Clark's was really instrumental in helping us create like a comfortable, attractive looking shoe that kids and families wouldn't mind using. So yeah, they've been a great partner for us.
That's awesome.
Mm-hmm.
I have a question. So I kind of keyed in on some things that you were saying. So you said 95% of the children that are treated are, have the the normal function. So, and then you also said if the treatment is done correctly, I've heard that a few times. So, what happens to the children that maybe that 5% that can't, or the treatment wasn't done right? Is that what happened to them? And so, do you go back in and do like a follow up training, or how does that work out?
Yeah. The main reason why treatment wouldn't be completely effective is that it's usually because the bracing stage wasn't adhered to properly. So kids wear the brace for up to 5 years following the initial casting treatment. So they wear it, I think it's 23 hours a day for the first year, and that's usually when they're still an infant and they can't walk. So they're still being carried everywhere. But that's 23 hours a day they're in the brace, and then that extra hour they're doing like little stretches at home with their parents and, to get the mobility of the ankle. And then for up to 4 years following treatment, they wear it at night. So usually the foot at that point looks normal. And so a lot of families don't necessarily think that it's necessary anymore to keep wearing the brace. And so they'll stop using it, or they think it's uncomfortable or inconvenient. And then they'll just stop using it. So that's why a big part of our work is this parent education piece. Can you hear me okay? I'm getting a little bit of static. I just want to make sure.
Yeah, can hear you.
Okay, great. So that's a big part of our work is the parent education piece, and just making sure that parents understand that, just like the retainer after braces on your teeth, like even once your teeth look normal and your foot looks normal, you still have to keep wearing the brace to keep it in that position. So, yeah.
That's great. Nice follow-up.
And actually, if I could just kind of follow on from Gary's question, you mentioned there was a little girl and she was 9 years old and she was having corrective treatment, at that stage. But then kind of further in the presentation, you had mentioned that it's obviously easier to do if it's, quite a young baby. So I suppose, what's the process if the child is just that little bit older?
Yeah, so it kind of depends, obviously, on a case-by-case basis. I think Miracle Feet clinics have treated children up as old as 15 or 16. And typically it'll just kind of take longer because the kid's feet are formed more so than a newborn baby. And there may, at that point, be some surgical element. But like I said, it's really on a case-by-case basis, just depending on the child.
Thank you. Does anyone else have a question?
I have a question. So you mentioned that 1 in 800 babies are born with clubfoot. Is clubfoot genetic, or is there a family history that predisposes a child to being born with clubfoot?
Yeah, that's a great question. And one we get pretty often is there is a genetic element to it. So sometimes parents will bring kids into the clinic and the parent or a grandparent was born with clubfoot. So although Miracle Feet, it's kind of harder to treat adults, especially because their feet are definitely very formed. So there is a genetic element to it. And like I said, you can't prevent clubfoot, but you can treat it. So at that point, we can treat the kids so they can walk.
Interesting. Thank you.
I have a question too. Y'all said that you're like in 57 countries. How do you all decide where to direct your work towards?
Yeah. So there's a lot of factors. Obviously, maybe not obviously, but probably the main thing we look at is just need. So we enter countries where there aren't established clubfoot treatment systems, either in the health system or other NGOs working in clubfoot already. And so we try to prioritize the countries with the lowest level of access to care. And then in addition to that, since we work so closely with our partner organizations, we look for countries that have strong NGO partners working, it doesn't have to be in clubfoot, but working in disability, children's rights, children's health, just related fields that we can find synergies with their missions as well. And we work with them to identify what we call clubfoot champions, which are basically orthopedic doctors or surgeons or physical therapists who can really advocate for our work and rally a team of other physicians and other physical therapists around supporting clubfoot care. So yeah, it's mainly the level of need in the country and the capacity to support a program through partners and the ability to find our clubfoot champion in each country. Do you have anything to add to that, Kira? Do you think those are the main
Yeah, I think those are the main thing. Also, funding, making sure funding is there for these countries. But yeah, I think Dana hit the main points.
Nice.
So I have a question kind of going along with that. So as part of that, then are you working with those governments to try and get this to be part of their healthcare plans for the future as well?
Yeah, that's the long-term goal. So our partners, again, are they meet with officials at the Ministry of Health, whether it's regional or local or national level, to advocate for the integration of clubfoot care into health systems, just in the way that, a child's born with cleft palate, it's identified the moment they're born and they're connected and referred to a provider who can treat it. Our goal is to get the same system set up for clubfoot care. And so that's very much a part of our work. And we already do implement a cost sharing model with governments in a lot of the countries where we work. So I think, I don't have the numbers exact, but like the high 90% of like provider salaries are paid for in Africa, and clinic space is within public hospitals already. So clinic space is provided for by the government. A point that I should say is we don't build a building for clubfoot treatment. We have basically Clubfoot Day, which is a day each week in each clinic that's located in the public hospital, and kids come to the treatment on that day for treatment. So the clinic space is provided for by the government, and provider salaries are paid for by the government. So we're already kind of implementing that cost sharing model, and the goal is over time that the government will take on more costs associated with treatment and be a fully sustainable system. So, yeah.
So I know that you said that your company goal is to reach 70% of the kids affected with this. Do you envision at some point a world where all the children, can have clubfoot treatment?
Yeah, that's that is definitely the goal. We think we know it's possible. It's just a matter of, the level of political will in each country. And there's a kind of a consortium of global health organizations working in clubfoot, and with a plan to hopefully achieve that goal by 2030. That's kind of the goal we're shooting for, is that we reach that number by 2030. So we'll see if it happens. Fingers crossed. But yes, that's the goal. And just a little bit of logic behind that number is that we say 70% because we're assuming a proportion of kids in the world and in each country their families have a high enough income to where they can already access treatment, whether it's by like traveling to a different country to get the treatment or going to a private healthcare provider. And then we assume there's a small percentage of kids that we just will not be able to reach due to geographical barriers. And so that's kind of where that 70% comes from. But that's our goal.
Okay. Thank you.
I have another question. What has been the biggest challenge your organization has faced throughout the COVID-19 pandemic so far?
Do you want to take that one, Kira?
Yeah, I can take that one. Yeah. So obviously, especially at the beginning of the pandemic, we kind of had to pause treatment across all countries. And so once clinics started opening again, there was a backlog of not only the children who were going through treatment, but also new babies who had been born who needed to start treatment. So once clinics started opening, it was kind of this influx of kids coming in that we kind of had to manage. And so if you look at our enrollment numbers, they dip way down and then they shoot way back up once things started opening. So I think we learned a lot of lessons during that process, but it was just kind of like this unexpected influx of all these new kids we had to enroll.
Yeah, one more thing I'll add is in that process of the clinics closing, was maintaining communication with patient families to prevent patient dropout. So, patients need to come back over a period of several months for casts. And then even once they're in the bracing stage, they still have to come back. At first, it's every 6 months, and it's once a year for follow-up visits to make sure their feet haven't relapsed, so turned back in essentially. And so a big challenge has also been just staying in touch with those families to make sure they know when clinics have opened again and they're reconnected to care as soon as possible. And we've done a pretty good job of that. Our bracing dropout rates haven't dropped as much as I think we would have thought they would. But we implemented things like SMS messaging and telecommunications and mobile clinics in different countries to really make sure we're getting out there in communities and communicating with families. So yeah, that's a great question though.
Perfect. Thank you. I think we have time for one more question if anyone has one. No, we all good? I think. Yeah, but thank you so much for, coming on and telling us a bit more about your work and, just going through, what your charity does,
Yeah.
Yeah, it was great being here.
Yeah, we're happy to. Thank you for listening and your insightful questions. And yeah, if you have any others, just feel free to email us. And but yeah, thank you for this opportunity.
Thank you very much. And thank you
you
everyone
so
for
much.
taking the time to join.
Thank you. Time.
Thank you. Nice
Bye,
meeting you.
everybody.
Bye everyone.
Bye.
Thank you. Bye.